Hello and welcome to section 17.2, where we're going to talk about the chemical defenses in chapter 17. So as we know, in our innate nonspecific immune system, we're going to use a lot of chemical mediators in order to inhibit microbial invaders. So in this section, we are going to be able to describe how enzymes in body fluids provide protection against infection or disease. We'll be able to list and describe the function of antimicrobial peptides, complement components, cytokines, and acute phase proteins. And lastly, we can describe similarities and differences among the classic, alternate, and lectin complement pathways. So first, we'll talk about the chemical and enzymatic mediators found in our body fluids. And so we'll focus on the different parts of our body that really assist with this, starting with our skin. And these can be endogenous or exogenous mediators. What I mean by that is with endogenous, it is produced by our human body cells, whereas exogenous means that it is produced by certain microbes that are a part of our own microbiome. And we're going to have things like our sebaceous glands that we saw in our previous section that are able to produce sebum or oil, and this helps to seal off the pore of the hair follicle because you can see that attachment right over there. Then we also have a special microbe known as Propionibacterium acnes and our fungus Malassezia that can use lipase enzymes to degrade that oil, that sebum, using it as a food source, which then is going to produce something called oleic acid. And that acid is inhospitable to a lot of bacteria. Now note that that was done through microbes, so that is going to be exogenous. So I have these little reminders on the side here. Moving into our digestive system, we have lots of different things here. Our saliva, our esophagus, that is going to have its mucus with the lysozyme, stomach, because it's so acidic, the small intestines, we've got our pancreatic and intestinal enzymes, the antibacterial peptides there, bile that's produced by the liver and our Paneth cells with lysosomes. So lots of different things that are really going to help us fight off any pathogens. And just a quick note about lysozyme, this is going to cleave the bond between our NOG and NOM in the peptidoglycan that is a component of the cell wall of bacteria, if you remember that from previous chapters. So it really is effective against our gram-positive bacteria. Gram negative bacteria, remember that's going to have that outer membrane, so it's a little bit harder to get through that in order to break the peptidoglycan components. Now let's move into the urinary tract. Just the urine being more acidic is going to help to combat pathogens. Within the female reproductive tract, we have lactobacilli that is a part of our normal microbiota in the vagina that are going to ferment glycogen and turn it into lactate. Now lactate can lower the pH, again creating that acidic environment, and that is going to inhibit our transient microbiota. Next up, we'll talk about the eyes and tears. Those also will contain lysozyme that we talked about before, and lactoferrin, which will inhibit microbial growth by chemically binding and sequestering iron. And if you remember from previous lectures, iron is going to be important for microbes. And so when we don't have it in place, it starves the microbes, and we know that they need it for growth. Then we've got in our ears, cerumen, also known as earwax. This is going to have antimicrobial properties because it has fatty acids within it, and it helps to lower the pH between 3 and 5. Again, inhibiting microbes. Lastly, we'll talk about the respiratory tract. We, of course, have mucus there that we've talked about before. That's going to have all of these different things like lysozyme, lactoferrin, and lactoperoxidase, and surfactant, which is going to be a little bit deeper in the lungs, but that has antimicrobial properties to it, which will inhibit microbes as well. All right, now let's move into antimicrobial peptides. So these can induce cell damage in microorganisms by damaging the cell membranes, destroying their DNA and RNA, and interfering with cell wall synthesis. And most of them are found in our skin, but they can also be found in other areas of our body. So here listed in this table are the main peptides that we have working within our body. We'll focus on defensins, which is a family of AMPs that are produced by our epithelial cells, the macrophages, and neutrophils. And we'll get into these cells a bit more in the next chapter, but they will help to damage the cell membrane of the microbe. And this is produced endogenously because of our epithelial cells and other white blood cells, right? The bacteriocins are going to be produced exogenously because they come from resident microbiota in our GI tract, and they'll also function by disrupting the microbe's membrane. All right, moving into our plasma protein mediators. Now, when we say that word plasma, which is where these immune factors are found, we're talking about the fluid portion of the blood that still contains the clotting factors. If you've ever heard the word serum, it's kind of similar, except that in serum, we are missing those clotting factors. So let's talk about the different types that we have. First being the acute phase proteins. These are produced by the liver and are secreted straight into our blood when we have inflammatory molecules from our immune system within it. And you can see in this table over here a few of the different types of these proteins and what their functions are. Now, another big topic is the complement proteins. There are 30 of these, including the ones we tend to talk about the most, which is C1 through C9, that normally circulate within the plasma. And when they become activated, which happens when they're triggered by a variety of factors, as well as there just being microbes present, we are going to trigger a cascade, and we call this complement activation. And there are going to be 3 mechanisms. This ties back to our learning objectives, but these 3 mechanisms are called the alternative, classical, and lectin pathways. And you could see them referenced in this figure over here. Let's talk about the alternative pathway first. This is when we just have spontaneous activation of the complement protein C3. We get a hydrolysis of C3, and then that is going to be cleaved into C3A and C3B. And if we don't have an invader present, then this is going to get degraded. But if we have an invader present, then we are going to have this protein attached to the surface of the microbe, and then it will kind of continue down the cascade that we're going to talk about in just a little bit. The other pathway is going to be the classical pathway, and this is probably the most efficient way to do this, and it's going to really depend on if we have antibodies present. When we have those antibodies in place, we are going to be able to bind them to the pathogen, and it creates this antibody-antigen complex that then is going to incorporate the C1 protein, and that complex becomes activated, and we are going to then be able to continue down the cascade to our end goal. But before we describe that, let's talk about the last pathway, which is the lectin pathway, which is going to be activated by having this mannose binding lectin, which is a acute phase protein, to the carbs on the microbe's surface. And this can be upregulated in response to inflammatory signals that the body is giving when it is infected, and will allow it to continue down the pathway toward the end here. And you could see that there's this membrane attack complex. This is also known as MAC, M-A-C, and this is effective only against the gram-negative bacteria because it can't penetrate that thick layer of the peptidoglycan in our gram-positive bacteria. So what really is taking place here is that these 4 types of proteins, C6 through C9, are going to create little pores or holes within the membrane of the bacteria or microbe, and that allows water, electrolytes, and other ions to come in and causes the cell to lyse. thus destroying the microbe. Lastly on this slide, let's talk about the cytokines. These are soluble proteins that are going to act as communication signals between the cells. So just think of like chemical messengers, and they stimulate production of other chemical mediators or other cell functions. That could do things such as cell proliferation, differentiation. It could inhibit cell division, cause apoptosis, or chemotaxis. And so we have three different ways in which these chemical signals can pass to one another or itself. First is autocrine, meaning that we're secreting cytokines and it's going to act on its own self. So this is one cell secreting the cytokines, it's acting on itself. Paracrine, think neighboring cells. It's close in proximity. So it secretes those cytokines and it goes to another cell that can respond to that with receptors for the cytokines. And then lastly, we have endocrine. This is like your long distance calls. So the cell is going to secrete the cytokines that move into our bloodstream, which is carried to a distant site, a distant cell, and that cell has receptors for those cytokines and can respond to it. And that is, again, our endocrine pathway. Let's dive in a little bit deeper to the cytokine classes. First is our interleukins. You'll see that these are usually referred to as IL-3, IL-10, things like that. So they're involved in modulating almost every function within our immune system. They're produced by and stimulate a variety of cells unrelated to our immune defenses. And at first we thought white blood cells produced them. That's why you kind of see that Luke term in there. But we now know that it is through a bunch of different cells. Our chemokines, these work to recruit our white blood cells to the site of infection, any tissue damage that takes place, or inflammation. And it is very specific types of white blood cells that get recruited with these. Then we have our interferons, and I'm not sure why, but I really find these fascinating. They work in defense of viruses, and we've got three different types, well, technically two different types, but type 1 would include interferon alpha and beta, and they're produced and released by cells infected with the virus already. And what they work to do is to inhibit viral replication so that we don't go and infect other cells with the virus. So they can stimulate those nearby neighboring cells to stop production of mRNA, destroy RNA that's already produced, and reduce protein synthesis that probably has viral information within it, and stimulate immune cells involved in viral clearance to more aggressively attack our cells that have the virus within it already. I feel like that's why maybe I like this so much, is because it's a warning system. Like, I've already been affected, so I have to go save my other fellow cells. And then we've got our type 2, which is our interferon gamma, and this is an activator of our immune cells to combat, again, the virus-infected cells. All right, moving on to our inflammation eliciting mediators. We've got histamine, which I'm sure you've heard a lot about already. It's a pro-inflammatory compound and secreted by our basophils and mast cells by those special cytokines. And that can cause bronchoconstriction and smooth muscle contractions to take place. Most notably, we know that this happens within our respiratory tract, which then can trigger things like asthma or allergic reactions. We've got our leukotrienes, and these are lipid-based pro-inflammatory mediators, and they're produced by a metabolism of arachidonic acid in the cell membrane of our leukocytes and tissue cells. And these will be more potent and longer lasting than histamine. And when histamine and leukotrienes are released at the same time, they can induce coughing, vomiting, and diarrhea so that they can try to expel the pathogen from our body. Then we have our prostaglandins, which are also chemical mediators, and they're promoting the inflammatory effects of our kinins and histamines. They'll also help to induce the fever by increasing our body temperature, and that higher temp will promote activities of our white blood cells and slightly inhibit the growth of pathogens. We also have our mediator bradykinin, which contributes to edema taking place, which you all know is swelling. It binds to the receptors of the cells within our capillary walls, and that will cause the blood vessels to vasodilate and make them more permeable to fluids moving into our tissues. And that will also allow our white blood cells to move into those deeper tissues to combat pathogens. Let's revisit our clinical focus on Angela. Angela is immediately treated with antihistamines and corticosteroids through an inhaler, and they're monitoring her. But unfortunately, after some time, these drugs are not alleviating her condition, and she gets admitted to the hospital and has allergy testing done to see if there's maybe something in her environment that's triggering this allergic inflammatory response that they think she's having. They'll also do a blood analysis to check for levels for particular cytokines and take a sputum sample so they can do microbial staining, culturing, and identification of any potential pathogens. So we want to ask ourselves, which aspects of the innate immune system could be contributing to Angela's airway constriction? Why was Angela treated with antihistamines? And lastly, why would the doctor be interested in levels of cytokines in Angela's blood?